It was a stuttering start to phase 2 of the national vaccination drive in Mpumalanga, parts of the province at least, where logistical issues meant some sites were unable to vaccinate at all. Now, have the issues been resolved and have they managed to start inoculating? Earlier this month, the Mpumalanga Health MEC, Sasekani Manzini, claimed that they will need only 21 days to vaccinate up to 67% of those who registered for the second phase once the Pfizer vaccines arrived. Now, will they actually reach that target? Let's find out. I'm joined via Zoom by the MEC. MEC, thanks for your time. We appreciate it. So you had some glitches yesterday. Have they been sorted?
Yeah, good day to you and to the viewers at home. Indeed, yesterday we can confirm that as a province we started with the vaccine. We launched it at Victor Kanya, a local municipality. And from yesterday, we managed to vaccinate 2,084. The only site that we had a challenge was Rob Ferreira, that I can confirm that from now we have got 223 people that have been vaccinated in that facility, in that area of Hesitancy. So we can say that as a province, we are fine, everything is in order, and we are looking forward. In fact, we have got more people that are there that want to be vaccinated. And as a province, we make sure that as work with nationally, all the allocation of the doses that we are given, we, of course, make sure that it is given to our people in the province.
Yeah, so talk to me about the problem in that particular site. I'm seeing reports that the department was saying that the Pfizer vaccine comes with a specific powder, or comes in a powder form, and a liquid solution is needed to dilute the vaccine, which wasn't there. Was that the problem?
Yes, that's what the problem, and hence you'll see that the other part, because our depot is at Middleburg, so it was easy to get into Gangala and Kharsibande. Hence yesterday we started, and this morning we also started at Rob Ferreira because it arrived in the hospital, just that it arrived late. But today, as I'm indicating, that so far we managed to vaccinate 223 at Rob Ferreira, and also Shongo Hospital, which is at Hesitancy, 138 so far. As from 1 o'clock. So meaning that everything is in order. We are continuing very well. Hence we said those that came yesterday, they can come back. But everything is going very well as a province.
And then going forward, MEC, are you going to be able to reach that target? Are you seeing enough people registering to be vaccinated, specifically the elderly?
Definitely. In terms of our preparation, we managed to make sure that we've got enough vaccinators. So that 21 days was informed by the number of population in the province if we receive the enough vaccine in the province, meaning that everything will be in order and ready for us to make sure that everyone that comes to our facility, even today, the allocation that we are given, we even make provision that we make sure that there's no person who's turned away so far, because we can see the excitement of the people that are coming forward to receive the vaccine, especially the elderly people. That on its own encourages us, and as a province, we are ready to make sure that they get the vaccine and they become safe as soon as possible.
In terms of hesitancy in your province, hesitancy, I should say, how is that looking? Are you having to go out into specific communities to encourage people to register for the vaccine?
Not at all. I think the first phase where healthcare workers to take the vaccine made it easy for us as a province, because currently, hence I'm saying the challenge is that we will be having more people, and more people want to take the vaccine now. So far, yesterday, the launch, we managed to coordinate it just a day before, but you could even see the response from elderly people. Everyone is just excited. They want to get the vaccine. Hence, I'm saying we'll work with national so that the more doses we get as a province, we are able to vaccinate as many people as they are. The problem was before the vaccine arrived, but now everyone is just excited and ready to get the vaccine.
Yeah. In terms of areas that are out of reach, how are you handling that situation? I was speaking about the Pfizer vaccine yesterday and the temperature it needs to be stored in. What's the solution there?
Yeah, hence so far we are having the big hospital that we are using to assist at. But what is exciting is that private sector is coming on board. The Honourable Premier is leading that. They are going to come and assist us in terms of the refrigerator, in terms of making sure that we reach as many people as we can. So we can say that we will be able to be in a position like yesterday we were at the location where we launched it, of which means that if we can get more vaccine, we will be able to be in a position to have the capacity to roll out, as we've got more than 1,000 of sites that has been identified, and as and when nationally approved those sites, we'll be able to roll out to those communities.
And MEC, if there are concerns from residents when they go to these vaccination centres, in particular the elderly, because you can't expect them to be waiting in long queues all day, right? How do they raise it? Who do they speak to?
Now, we have got healthcare workers in those sites. We've got people that are assisting them, people that are registering, and we will be there. Our team will be there to assist them. And of course, the local municipalities on board, your councillors, they will be there with us because we'll be using the sites in the different wards. So they are going to be there to assist us to make sure that everything goes well. And what excites us also is that so far, as far as those that have got the vaccine, no adverse event reported from those elderly people that received the vaccine. So we'll be working with the local municipality to make sure that everything goes well and smooth, and our elderly people don't have to wait, and they must come at the particular time that they are supposed to.
All right, thank you so much for your time. We appreciate it. That was Sasekani Manzini, Mpumalanga Health MEC.